Hi, everybody. I'm trying to make an update. I know it's been a while, and I had some people writing me asking me to. I stayed off. I did not want to make updates. Things have been very difficult. I did end up having to go back to the hospital, and I didn't want to post everything on there. And that was last week. I was there for about 4 days, trying to figure out exactly what was going on. I had some complications and some pulling. Every time I swallowed a sip of water, it would cause all my stomach to spaz just off of a sip of water. So I ended up having to go back, and we couldn't really figure it out. The gastro team is fighting the gastric bypass team. They're not in agreement with things. I've been, since yesterday morning, I woke up and I've been having really bad esophageal spasms. I just talked to them. We don't know why. Everything has to do with adhesions. They think there's just adhesions. So I'm going to constantly have this problem. Once again, that's where reversal is going to be key. I am 100% on getting this reversed. We just got to get my body up to par. They were supposed to do surgery last week to do an upper endoscopy, go down and cut some of the adhesions inside. But that did not happen because the gastro surgeon that came to see me wanted to explain to me why it was important to have it done. But the gastric bypass team argued with it and said there's too much inflammation to go inside. So nothing got done. And I'm just like, send me home. I've had enough. So I'm home. I'm waiting for them to call me back right now and address the part of the esophagus and why it's making it hard for me to swallow anything right now. I believe it might have to do again with adhesions on the inside, which is the gastro team was right. We should have did the upper endoscopy to see, but that did not happen. I'm just not trusting doctors right now. I'm not trusting any of them. They got too many residents that don't know their ass from their elbow at Mayo Clinic that seem to make a lot of these decisions on different things. And like they just got a whole slew of residents that came in June. I don't know how they're handpicking these people to be for Mayo, but their knowledge base is not good. They might have become a doctor from a book, but as far as experience and actually understanding maybe what they learned, it's like really bad. And I've really, from the experience I've had right now with them, I just don't have any words. I'm waiting for reversal. I just need to have that done ASAP. I just don't really have anything very positive to say right now. Every day is a new struggle. Every day there's something happening. I usually wake up with it, like yesterday morning, woke up with my esophagus. Why? Who knows? It just did. It's always something. And like they said, it's going to be constant until this is reversed. And then I'll have some complications from reversal that I have to deal with. But I feel like at this point, I'm going to have a lot less complications with reversal than I'm going to with what is going to be constant the rest of my life with this part. I've only lost 68 pounds. Remember, 50 of it was pre-surgery that I did myself. So I've only lost another 18 pounds in over 2 months since this surgery. So it's not good. Like, this thing has done nothing good for me at all. I am 100% against any type of gastric bypass surgery, especially for cancer patients. I just think that there's laws that need to be changed where doctors can't threaten people that they're not going to be able to get their chemo unless they have a gastric bypass, or they can't have knee surgery unless they have a gastric bypass. I think that at one point someone needs to be made an example of that. You can't threaten people and that unless they have gastric bypass, you're not going to medically help them. I think that that's something that's out of control right now. And that is what's caused me to have the situation I currently have. Because if I was not told that I wasn't going to be able to receive my chemo based on my weight, which was all from steroid use, not from a overeating problem, then I would have never have had this surgery. So I'm just upset. I think I'm in a point of anger. I'm angry because I can't go back in time and change. And I can only recommend to you, don't have this done. Don't deform your body. Don't rearrange your body. The liquid diet was everything, and I was fine with that. I was in such good shape with that. Like, the liquid diet was everything. I mean, doing that for the 7 weeks was absolutely the best thing of my life. And then it just got destroyed. So just wanted to let you guys know that's where I'm at. Still struggling day by day, one day at a time. I have 3 new areas of adhesions, and my esophagus is being pulled on. So who knows what's going to happen next. So that's my update. Sorry it's not so positive. At this rate, I'm just in pain and not a lot of positivity. All right. Talk to you soon.